Okay, the paper I looked at was called The Risk-Benefit Balance Associated with Obstetric, Neonatal, and Child Outcomes After Metabolic and Bariatric Surgery. And here's where you can find this article. Basically, we currently have an epidemic in the planet of about 2 billion people being obese or over a BMI over 35, many of who are women of childbearing age. We know that there are risks with associated with a higher weight or higher BMI in mothers. Mothers who are overweight can have a higher chance of miscarrying, stillbirth. Um, when they do get pregnant, they have a higher increase of gestational diabetes, hypertension, and preeclampsia. Babies have a higher chance of congenital fetal malformations or being born prematurely. The big significant increase is the large for gestational age of babies who are born to mothers who are overweight. And this can cause obstructed labor, shoulder dystocia, many who will have to undergo a C-section for delivery, and that comes with its own complications. So the study um, looked at mothers who had had babies and then had undergone a weight reduction type surgery. Here you see there's three types of surgeries. The two main ones we're going to look at is the Rowan-Y gastric bypass. Um, this one has, if you, as the one in the middle, you can see that it totally bypasses the gastric um, stomach, but it does come with risk of malabsorption or malnutrition. And the second one there is a sleeve, which significantly reduces the amount a mother can eat. Both of these do cause a lowering or a decrease of BMI because of weight loss. However, they both have an increased risk of malnutrition, and that is what we're going to look at. So the data source was taken from the French Nationwide Hospitalization Database Program, or the BMSI, which has approximately 67 million people in it. They looked at data from January 2011 to December 2020, about a decade, and it included mothers that had had at least one prior pregnancy and had undergone the gastric bypass. There was a 5,000 or 53,813 women that were included in the data pool. Out of that, 3,686 women who had at least one pregnancy prior to surgery and one after surgery. There was also 7,383 women who had at least two pregnancies prior to surgery and one after surgery. So what did they compare? They looked at the data collected and they checked the weight of the mothers and babies, the health of the mother, and the health of the baby for at least the first 2 years of life. They compared that with the subsequent pregnancy of the weight of the mother, the health of the mother, and the health of the child. What did they? So one of the major significant findings of the paper was that there was a reduction of large for gestational size in the infants. So mothers who had had a prior baby before losing the weight and had a subsequent baby after the procedure had smaller babies. In this graph, you can see there was a decrease in large for gestational size. So in the yellow here, you see this was the first baby prior to surgery with a large gestational size. After surgery in the blue, you see that the next baby was of average size, or there was a decrease in large for gestational age. However, along with that came the small for gestational size increase. So here you see that mothers who were overweight in the yellow had less smaller for gestational size prior, but after surgery had a significant increase of small for gestational size infants. And the paper talks about the nutrition being the major factor of that increase in small babies. Here you can see the maternal risk decreased from less gestational diabetes, hypertension, in mothers who had undergone the surgeries. So mother's health improved after surgery. Um, and you can see here that in babies, there was a less stillbirths, there was less complications in babies overall, being that the small for gestational size was the main risk factor now post-surgery. If I was looking at this study, one of the questions I did have was, because mothers who are obese, we know there are risk factors for their child growing up becoming obese or having hypertension, diabetes. I would like to know is if they would take the babies prior to surgery compared to their siblings after surgery and see if there was a significant difference between obesity rates, hypertension, diabetes, and later in life. That would be an interesting thing to follow to find out if mothers losing weight was a significant source. Thank you very much.